Reflux and bottle feeding part 3. To know what's normal, check out part 1. For breastfeeding tips and tricks and how to help with regurgitation and reflux, check out part 2. And this video will solely focus on things that you can do during bottle feeding to help reduce the amount regurgitated and also to help with reflux as well. I'm going to label this as an ad as well because I will be showing a man bottle when I show the paced bottle feeding techniques that will help with reducing regurgitation and reflux. And I work with them at baby shows and on a consultancy basis too. So 4 in 10 babies will have reflux in that postnatal period and in the first year of life. And if you can, after feeds, keeping your baby upright for at least 20 minutes, and this is where baby wearing slings can be really useful to keep your baby in an upright position, will help reduce the amount regurgitated. The next thing I want you to look at is the infant milk that you are giving. So babies should be on the first stage infant milk for the first year of life. And I've said it in previous videos before, whilst nutritionally all first stage infant milks are exactly the same in terms of calories, carbohydrates, fat, protein and vitamin count, what you want to look at is if you turn around your first stage infant formula and you look at the bold ingredients, you might notice that in the one that you are using, there's a specific allergen. As an example, things like soya or fish oil, for example, or egg protein. And for some babies, literally switching to a different brand without that allergen, that bold content in the back of the ingredients pack makes all the difference and reduces that reflux for that baby. You do need to try it for at least 2 to 3 weeks before noticing any differences. The next thing, many of you are going to really dislike me saying, but believe me, when I used to suggest it in my health visiting, the moment they removed it and went back to basics, honestly, lots of reflux stopped. And that's because they stopped using a prep machine to prepare their formula. The difficulty being when prep machines are used, and there's lots of research showing that it doesn't quite keep at the 70-degree temperature that you need to kill off any bugs and bacteria. One of the reasons behind reflux is that there's an imbalance in the baby's gut microbiome, so that's the good bacterial count. And sometimes an overgrowth of bacteria can exacerbate and make worse reflux. Independent research has showed that those prep machines do not stay above 70 degrees when making up formula feeds. And so if you've got a baby's gut that is already slightly out of balance from a bacterial count, maybe because of the type of birth that a baby has had, maybe because there's been antibiotics at some point, either in pregnancy, labour, birth, postnatal period, well, making up feeds that maybe have a slightly higher bacterial composition then can exacerbate and make worse reflux. And it's where I mentioned probiotics in the previous video. But from experience, when I was working as a health visitor, when mums would come in with colic or reflux, would talk about how they were making up feeds, how the feeds were going, and suddenly, if they got rid of it for 2 or 3 weeks, babies became a different baby. And it's one of those things, if you try it for 2 weeks and there's no difference, go back to it, that's absolutely fine. But literally just trial for 2 weeks without a prep machine and see what a difference it can make. It's also a really good prompt to make sure that you're cleaning your filters and making sure you're doing the clean cycles on them as well. And the next thing, if you're not on any milk thickeners, sticking with the slowest flow rate teat will help with the air intake with baby. So the slower the flow rate teat, the better, because baby's not having to gulp and gulp and gulp with huge amounts coming through the teat. So the slowest flow rate teat for as long as possible, and paced bottle feeding. And paced bottle feeding has been shown to lower the amount of milk that has been regurgitated. There are several reasons for this. This works more in line with responsive feeding. By keeping the baby in an upright position, it will enable any air to come up more easily during that feed. What will also happen is the baby will have smaller amounts more frequently, so give a small amount, take the bottle out of their mouth, wind them. Once they've brought up some wind, give them a little bit more. Again, take the bottle out of their mouth, wind them. And the reason being, if you give them an entire bottle in one hit with a lovely air pocket down at the bottom of their stomach, you now wind them, they bring up half of their feed and it looks like a huge amount. So doing the paced bottle feeding small amounts, little and often, will really help. And it does need to be said though, if you start thinking about milk thickeners or your baby goes on to milk thickeners, then you're going to need a faster flow rate teat for that baby to be able to feed effectively. If you can, get a feeding assessment from your health visitor and have a look for any tongue ties or restrictions. How is that baby feeding when you are bottle feeding them as well? Tongue ties can increase the amount of air that is swallowed and again can be a reason behind reflux too. As I said in the previous video, seeking a health visitor out to be able to do a feeding assessment and to be able to holistically look at you. Have a conversation with your GP as well to see if there's any reasons behind the reflux that could be treated too. And this is where, after an assessment, your GP or health visitor may be able to consider things like alginates, which are like Gaviscon, for example. It may be a milk thickener is needed. It may be that they start questioning if there's any other symptoms, whether there's any allergies present within your baby, where an alternative milk formulation will be advised and recommended and prescribed. All of this requires your baby having an individualised assessment with all the symptoms that you provide. I'm hoping that this video will have provided you with some foundation so that you'll be able to go much more confidently to your health visitor for your GP for information and advice. And as a reminder, you are doing brilliantly. Reflux is really hard to be able to witness as a parent, to be able to have a baby who has reflux. I'm sending you a huge amount of virtual support.